Hello, viewers. I am David, the nurse. I am a registered critical care nurse. Thank you for watching my YouTube channel. In my previous video, I started up a discussion on oxygen administration via nasal prongs. So in this video, I will be moving on to another type of oxygen delivery device, which is simple face mask. Simple face mask is made up of four major parts. The first part is the metal piece. Metal piece is a flexible metal, and the flexibility helps to manipulate or adjust the face mask so as to conform to the shape of the nose. It is important that at that level, the face mask is fitly attached to the nose to prevent unnecessary escape of oxygen into the atmosphere, which of course leads to wastage of oxygen, because we want to ensure a firmly fitted face mask. This is very important. Then, exhalation ports. Exhalation ports are the holes on both sides of the face mask. It's located on both sides, both the right and the left side of the face mask. And as the name implies, it works majorly during exhalation. When the patient exhales carbon dioxide, the carbon dioxide escapes through the holes in the exhalation ports. Then the strap. The strap is made up of rubber. It helps to firmly fit the simple face mask to patient face, and it's always attached around patient's head. The connector helps to connect the face mask to the oxygen source. The next thing I will talk about is the flow rate that is set for simple face mask. I elaborated so much on the oxygen flow rate used when giving oxygen via nasal prongs, that it should be between 1 to 4 liters per minute. But the case is different for simple face mask. Considering the structure of a simple face mask, when face mask is attached to the patient's face, it forms an enclosed space. And when patient breathes out, the carbon dioxide will be retained within that enclosed space, and just little amount of the CO2 escapes through the exhalation ports. That is why when using simple face mask to deliver oxygen to the patient, a higher level of oxygen is needed, and that is between 6 to 10 liters per minute. This high level of oxygen provides sufficient pressure to wash out the CO2 in that enclosed space. This is very important to note, and thereby preventing carbon dioxide retention. We want to avoid a situation whereby patient exhales CO2, and then when patient wants to inhale, still inhaling the CO2. We already know that when giving oxygen, we want patient to inhale the oxygen. Our intention is not for patient to inhale carbon dioxide, so we must put all measures in place to ensure that we minimize CO2 retention. And one of the ways to minimize carbon dioxide retention within the enclosed space in the simple face mask is to give a high level of oxygen to the patient between 6 to 10 liters per minute to ensure carbon dioxide washout, thereby preventing carbon dioxide retention. And when there is carbon dioxide retention, it's a condition that is referred to as hypercarbia or hypercapnia, in which there is buildup of CO2 in the blood. When this happens, it has a harmful effect on the central nervous system. It causes CNS depression, can manifest as headache, as confusion, as fatigue, as some patients may develop seizure, some can lose consciousness, patient can go into coma, and that is important for us to know this so as to prevent such occurrence. Also, exhalation ports also gives room for oxygen from the atmosphere to be inhaled by the patient. So, patient is not only getting oxygen from the oxygen source, some of the oxygen from the atmosphere can also escape through the exhalation ports, and patient also inhales it. Okay, we have discussed part of a simple face mask, metal piece, exhalation port, strap, and connector. Factors affecting patients' FiO2. In the last YouTube video I did, I gave a formula for fraction of inspired oxygen to be 20% plus 4 times oxygen flow rate. Now, there are factors that can diminish the fraction of inspired oxygen of the patients. For instance, I have a patient and I want to give oxygen via simple face mask. I set my flow rate at 8 liters per minute. If I want to calculate my FiO2, it's very simple. That will be 20% plus 4 times 8. 4 times 8 is 32. 32 plus 20 is 52. And my FiO2 has been calculated to be 52%. With this calculation, I should bear it in mind that the FiO2 can be diminished or can be affected by certain factors. Number one, the rate of respiration. When the respiratory rate is low, or when there is decreased rate of respiration, it can diminish fraction of inspired oxygen. Respiratory rate simply means the number of the cycles of respiration in 1 minute. For instance, a patient that is having respiratory rate of maybe 8 cycles per minute, that's bradypnea. Such patient's FiO2 will definitely be diminished compared to a patient that has normal respiration of about maybe 16 to 20 cycles per minute. Next is the depth of respiration, which we can also call tidal volume. Tidal volume simply means amount of air inhaled or exhaled at normal respiration. So patients with shallow respiration will have a diminished fraction of inspired oxygen. Now, combination of the rate of respiration and depth of respiration gives us what we call minute volume or minute ventilation. Minute ventilation simply means the total amount of air inhaled or taken in by the patient in 1 minute. So how do we calculate that? We calculate minute volume or minute ventilation by multiplying the rate of respiration by the depth of respiration or the tidal volume. Okay, what am I trying to say? The formula is this: minute volume is equal to respiratory rate multiplied by tidal volume. For instance, a patient has respiratory rate of 15 cycles per minute. And the tidal volume is estimated to be 500 mils because tidal volume is measured in mils. The minute ventilation will be 15 multiplied by 500. And when we calculate that, that will be 7,500 mils, or let's say 7.5 liters. That is a minute ventilation or minute volume. And that minute volume gives us the total amount or total volume of air that the patient is able to take in 1 full minute. Okay, the last factor to be considered here that affects patients' FiO2 is pathophysiology, that is disease condition of the patients, can also diminish patient fraction of inspired oxygen. Advantages of nasal cannula over face mask. Number one, communication. Patients on nasal cannula can talk, can speak, can communicate freely, and it will not affect the rate at which oxygen is delivered to the patient because of the structure of the nasal plugs. But patients on face mask, the face mask covers both the nose and the mouth. So patients has some impediments or hindrances in communication. Number two, feeding. Patient can be on oxygen via nasal cannula and still feed, but that is not so for face mask. Patient has to remove the face mask and then feed. The third advantage is reduced risk of aspiration. Patients on nasal cannula, when they vomit into maybe on the bed or into the space. Unlike patients on face mask, when they vomit inside the enclosed space in the face mask, and there is high risk for aspiration. And lastly, reduced risk for CO2 retention. That has been explained. How can we prevent that? I've already said that it is simply by giving high level of oxygen between 6 to 10 liters per minute that will help to wash out carbon dioxide from the face mask, and also to ensure that the exhalation ports are not occluded. They must be open to prevent CO2 retention. All right, this is the end of this video.